welcome to NHP's On Your Mind, a special 8-part series on 99 FM where we engage with various healthcare professionals to unpack a number of extremely relevant topics related to the well-being of Namibians. We will also be addressing the mental, psychological, and physical attributes of the points at issue and share valuable information and advice to the Namibian public. It has been such a devastating year and in different degrees to different people. But for those that have been hard hit, what or where can people find help and hope if they feel completely devastated by what we've just been going through?
I think in terms of when you say completely devastated, we need to understand in what aspect have they been devastated?
Okay.
Are they devastated in terms of financially? Because financially, you need support. Financial support before you can, because financial hardship can breed psychological hardship, it can breed depression, and it can impact on a lot of things. It can cause malnutrition, it can cause a loss of family, it can cause a loss of shelter, etc. So first identify what your need is and then reach out for the people that can help you, because you cannot come to a psychologist if you're hungry.
True.
That's not going to help, yeah? So first of all, make sure that you identify what the need is, and whoever is able to support, we should all learn to try and lend a hand where you are able to make the impact. There's no point in me wanting to go and support somebody that needs somebody to help them do their finances, because I'm not good at that. So first recognize, identify what your need is, first get the shelter, etc. And after that, everybody needs the psychosocial support. If you've been affected by COVID in terms of you became positive and you spent weeks in hospital, or you've got the lasting remnants of the impact that it has on you, whether it is fatigue or it is constant headaches or it is a cough or whatever that lasts, you could use some kind of support in terms of emotionally, mentally, because the impact that it has on you, we still don't know long-term what the effects are going to be. And the long-term effects and the fear thereof and the stigma that is attached to it, definitely you will need some mental and emotional support. If you're a person that is not very privileged and is poor and you've got COVID or you've been impacted by it, you definitely need financial support, you need psychosocial support, all of that, you need long-term support. So I think what I'm trying to say is, in the past and in general in Namibia, there's really not enough provision made. We talk about financial support, etc., but in terms of emotional support,
not so much.
There's not really enough support.
Okay.
So especially post-COVID, we are going to need a lot of social workers, psychologists, etc.
Yeah.
Whether it is at hospitals, whether it is in communities, at the schools. So
Especially.
we really should look into that, because COVID does not discriminate. Whether you are rich, you are poor, pink, purple, we are all at risk. And there's really, the worst thing that can happen if somebody tells you, no, if only they'd done that, if only they'd gone to the private hospital, not the public hospital. Those kinds of things, because the minute you start telling somebody who has been impacted or affected by something, there's something that you could have done, you should have done more. What you're doing is you're causing the person to have guilt, and that's going to make everything a lot worse.
We really did take for granted the fact that in this country we didn't have healthcare professionals like social workers in schools or in hospitals readily available, and we're learning from that. And I think I want us to touch on that. What can professional healthcare providers do to help? So we really do see a need for it.
Yeah, I think one of the things that, because COVID does not discriminate, it's not about where you live or who you know or who you are. The healthcare professionals themselves now need support.
Oh, wow. So
that
true.
is what makes this even more difficult.
Yeah.
The healthcare professionals themselves are extremely stressed. I experienced that personally because I went to have somebody admitted at the hospital, and the healthcare professional is so stressed, and the focus is on social distancing, the focus is on all of these other things that emotionally you're making this worse for the patient and the family member. So that kind of dynamic, and I understand because of COVID, we need to have the gear, we need to protect ourselves.
True.
But what are we protecting? Yes, we will walk out physically healthy, but then what happens after that? Because that person has left, the healthcare professional themselves. I mean, if we look at the amount of healthcare professionals that have become sick themselves, that have passed on themselves, that is really something very important to take care of. This is nothing, even the fact that we need psychosocial support has nothing to do with COVID even. That is something that we need in general. In Namibia, we keep talking about babies that are being dumped. We talk about
GBV.
poverty. We talk about GBV. All of those things. We cannot say even that post-COVID, we are going to place 3 psychologists for every grade in the school. And then what happens 6 months later, they are not needed anymore. It's not like that. Let us learn from COVID. Let us be prepared. Let us practice hygiene. Recently, I had somebody admitted at the hospital at the COVID ward, and you're sitting there in the middle between Ward B, where the COVID patients are, and Ward A. The Ward B is immaculate. However, if you ask to just go to the loo in Ward B, or Ward A, it is something completely different. We cannot have these dichotomous views and living like that. Yeah? We need to practice what we preach, and we need to be consistent in our care for all human beings. Yeah, that is something that I think is very important. So practice what you preach. If you are taking care of a child at a school in Katutura, that child should have the same access to clean water and clean toilets as the child at the private school in town, in Olympia or wherever. That is something that we have to, keep. And in the same way, the support, the hygiene that we practice and teach our children should be the same. But unfortunately, it is not. And I'm hoping that the cleanliness and the access to water that all people are experiencing, or maybe supposed to be enjoying right now because of COVID, is something that's going to continue. Hopefully. What I thought was amazing is when you hear the municipality say that they are going to write off the bills for the people that are, old age, etc., or just open the water so that everybody has access to water. If only that would continue.
We hope it will.
Yeah.
Thank you so much, Ute, for coming and for joining us.
It was a pleasure, Sim.
And that's it for part 2 of NHP's On Your Mind, where we spoke to Ute Sinkala and we addressed the Corona Blues. What are we thinking and feeling post 2020? Thank you for joining us.